Hello, I'm Natasha Kavanagh for Dubai Life TV. I'm here today with Dr. Nikolaos Zavrakidis, who's a vascular and endovascular surgeon here at the American Hospital. Dr. Zavrakidis, tell me a bit about your career as a surgeon to date.
Thank you for having me, Natasha. I am trained first as a general surgeon, actually, in Germany, where I worked for 10 years, doing different kinds of operations from general surgery, trauma surgery.
Which vascular diseases would you say are the most common here in the UAE?
Maybe the most common disease is varicose veins. It's not very dangerous. Mostly it is harmless. It gives symptoms, of course, but it's probably the most common vascular disease.
Dr. Zavrakidis, as I'm sure you'll know, varicose veins are a common problem. What advice could you give to people to prevent such an occurrence?
You cannot really prevent it if you have the disposition from your family. You can do something to not accelerate it. Being physically active and not overweight and things like that, it may help to push it in the future. Okay. But you cannot really avoid it if you have the predisposition. You have to treat it.
What treatments are available for the removal of varicose veins here at the American Hospital?
We offer different kinds of surgery, laser surgery, laser ablation as it is called, foam sclerotherapy, and normal conventional removal, stripping for patients who have big varicose veins and other. It depends how the disease is, what the patient wishes and different factors.
Okay. And what aftercare is available for something like this? Is it a long recovery?
It's not a big operation or treatment. It depends a little bit on the kind of the treatment option the patients, after our advice, chooses. Foam sclerotherapy is a bedside procedure. The patient comes in, gets the procedure done, and can go home. The laser ablation procedure is a little bit more, but it's still a day procedure. The patient can come in and the same day can go home.
Are there any preventions for vascular diseases that you treat here that you would recommend?
Right. Of course. Another very big part of vascular surgery and endovascular surgery is arteriosclerosis. This is a lifestyle disease. This is sometimes quite serious disease, and there are risk factors, smoking and what we understand as a healthy lifestyle. If the patient has any signs or symptoms, I would suggest that they have an examination done.
What symptoms would you expect them to see?
It could be different kinds of ischemia, meaning a bad perfusion. It depends where the problems are. It could be pain in the legs. It could be it's the same disease for cardiologists. We have myocardial infarctions and like that. Yeah, but it's the same disease in other parts of the body.
Dr. Zavrakidis, thank you. It's been very nice to come in here and meet you today at the American Hospital. Thank you.
Thank you.